Welcome to Playful Beginnings, a podcast about the magic of play therapy for therapists, students, and anyone interested. In our podcast, we'll explore the deeper understanding of play therapy and the skills we use when working with children.
We hope to help you understand the why behind what we do and how it helps kids heal and grow. I'm Dr. Christy Opiola, a working play therapist and university professor in North Carolina.
I'm Dr. Maggie Parker, a play therapist and professor in DC. Hi, Ahou. It's so nice to see you.
Hi, it's so good to be here. Thank you guys for having me.
Yeah. So for our listeners, we are talking to Dr. Ahou Line, who is a colleague of ours, and she is the co-founder of Thread Counseling Group. She is also a presenter of all things play therapy, from parenting to working with Middle Eastern families. She is also a graduate of University of North Texas, like Christy and I. And you and I, who met just kind of randomly at a play therapy conference. And Christy and I have talked about this in the past of how you just kind of gravitate towards each other. And I met you and I was like, yeah, we're going to need to be friends. So I'm really happy that you're here and that you could come and talk to us. We've just done 2 episodes on working with parents and kind of like going through the questions we ask and things to think about. And so we thought you would be an excellent person because you're writing a book on this right now. And so you should also share all of that information.
Yes. Yeah. So this all kind of started, I would say, in practicum. Not when I'm thinking like, oh, I was born on a rainy day. Like it didn't start that long. But it started in practicum. I always tell this story. Like I was in grad school. I had done all my play therapy classes. I was so excited to work with kids. I'd been a teacher previously, and I get my first client, and it's an 8-year-old boy. And my supervisor's like, okay, well, go call the parents and set up a parent consultation. And I froze and was like, what? Like, what? Excuse me? I have to go talk to their parents. And so I remember that feeling of dread and fear and worry about having to talk to the parents and knowing like this massive role that parents play in kids' lives. And I just felt so incredibly unprepared. Like even as a teacher, I would avoid making calls home because I was so scared of talking to parents because I was so afraid of messing it up. And so as I was in private practice and then as I started the doc program, I think where like my interest in working with parents came from is just that I didn't know what I was doing. And so I was like, how can I get as much information as possible? How do I figure out all the mistakes that I've made to like support other people and not making the same mistakes? And so that's really where my passion for this topic came from. And then as I was working in the doc program, a lot of the things that I wrote for my various different classes were about working with parents. And then my dissertation ended up being about play therapist attitudes toward working with parents, which was really, really interesting. And so it's, again, kind of just been this natural progression of like, I don't know what I'm doing. And now I'm researching it to try to figure out what I'm doing. And so that's where this book kind of comes in. So I'm hopeful that it will come out in the summer, but it's a book that is created for play therapists, both who are in graduate school, but also that are practicing, that really talks through like the history of working with parents, all of the research related to working with parents, and then really goes into the nitty-gritty of best practices and what to do. And the way I'm designing it is really focused on how do you pick up this book? How can there be tools in this book like a parent consultation guide, different handouts for parents, where it kind of becomes like this one-stop shop for play therapists who just really want to grow in this skill. So yeah, thanks for plugging that. I'm very excited for it to come out.
No, but I think like that's a common thing. Oh, go ahead, Christy.
I was just going to say it's a lot of hard work to write a book. Sounds like a very comprehensive that you've kind of built up to the writing process, but also a really helpful tool for clinicians in the field, students who sometimes are as insecure or feeling incompetent to work with parents. And the funny thing for me, and I don't know if this is true for you, Ahou or Maggie, I mean, parents are just like kids. They're just big-bodied forms, right? And like they have the same needs that our play clients have in session. And so it's just so funny that we get so nervous or anxious. Maybe because they can verbalize it better. And with kids, we're reading some of the nonverbal and other skills, so it feels safer. But my experience is they have the exact same needs.
Yes. Yeah. I was a play therapist before becoming a parent. And so I have had the experience of, holding on to the side of the chair when the parents are like, do you have kids of your own? And I have to like be like, oh gosh, I have to tell them no. To becoming a parent and being so unbelievably humbled by by becoming a parent and realizing like I actually know nothing. So it's really interesting having kind of gone through that journey and then also having this interest in working with parents, because what I think it's done is just provided me with so much empathy of how scary it is to bring your kid to play therapy, and how so much of that fear can manifest in different ways. Like it can look like anger or questioning of your expertise or pulling your kid out of play therapy because they don't think anything is working, right? And so to me, I think the reason why it's so hard and so complex is because we're not working with parents when things are going really well. We're working with them when they're in crisis, but the difference is you're not their therapist. And so your touch points with them are so few and far between that you are building this relationship with someone in crisis, but you're only seeing them once every 4 to 6 weeks. And then you're telling them things that are so hard to hear,
Mm.
like here's this thing you have to change at home. And so to me, I just think it is so complex and so nuanced that of course it's hard. Like it's unlike any other like therapeutic relationship that I think we have.
Yeah. I hadn't really thought about it that way because you're right. Like they are coming to you in crisis. And I think I like as Christy, you were talking about, I was like, what, how do I respond even if kids do that? Right. Because there's sometimes like a lot of defensiveness and I think that's based, like you said, like in fear and feeling out of control. And even when it happens with a child, when they're like, you're dumb, usually I'm like, oh, and that's where I like start sweating. And so it makes sense that I also start sweating when parents say those things. And I think being prepared, and I think that's what's really helpful about your book, is really feeling like, okay, I know what I'm doing and this is okay, and how to approach it, and remembering that they're scared can be really helpful. When you're caught off guard, sometimes when you're trying to convince them that play therapy is beneficial and helpful, that's usually, especially earlier on in my career where I felt not on strong footing, I guess, if that makes sense.
Yeah. Yeah, it does. I think I always talk about this whenever I present, and I talk about this a lot in the book too, is the importance of presenting like an expert. And I think therapists just by nature, like especially play therapists, there's so much humility in it, and it requires so much humility of us. But I think when you work with parents, they want you to be an expert. I always tell a story. When my daughter was born, she had a little hole in her heart. And so she was 2 days old, and we had to take my 2 day old little tiny little nugget. I'm still postpartum, like I'm still in diapers. I'm not doing great. I had to take her to a heart specialist, and I talk about this experience of what I needed from that specialist in that moment. And I didn't want him to sit there and like, tell me, it could be this and it could be that. And you're the expert. Because I'm like, I know nothing about babies' hearts. I need you to tell me what to do. And the way he handled it, he walked in the room. He didn't say, how are you? Because that was a silly question. I wasn't good.
Yeah.
And he said, let me present the facts. And he just sat there and presented every single fact in order and told me that she was going to be okay. And I took this massive deep breath in and felt relieved. And then he said, okay, now how are you? And then allowed for more of that conversation. But he came in like such an expert, which is what I needed. And when we have parents who are coming in and their kids have had suicidal thoughts, right? Or are about to get kicked out of school or whatever it is, like they're feeling the same way I was feeling when my 2 day old had a hole in her heart. So I think that the importance of presenting like an expert, which I do think is just naturally hard for a lot of us because we present with so much humility in a lot of our therapeutic settings.
Yeah. I appreciate that. I would have never thought about it that way. Even as a parent whose child goes to play therapy, you're right. You need that confidence. Like you want that confidence in a surgeon. You want that confidence in your play therapist.
Yeah. Yeah. Because you do. I mean, of course, there's so many different ways play therapy works, and there's so many different, we don't always know what's going on for the child, and we don't always know this is exactly what they need to do. But even if I can present those options in a confident way, I do think it gets parents to trust me and trust they want to know that I know what I'm doing because they're following my lead too. And so, yeah, it's hard. I know I lacked so much confidence in play therapy at the beginning too, because it is, to say like we were called interns back then. I'm an intern and I looked really young, and like to tell you what to do with your child. And so we'll say it's easier now, time experience on my side, but it's still hard.
Yeah. I was just even thinking as you were talking about, right? Like that really mirrors the research we know about in like neurobiology. So if you come in as a play therapist and you're anxious and nervous, the parents' mirror neurons are picking up on that. And so how does that feel safe to then entrust my child to you when we're in crisis, when we don't know what to do? And the way, even if you're trying to fake it, what I'm picking up is, oh, and sometimes I wonder if that's why that question comes up, because I think when you're a more experienced play therapist, I don't get asked, do you have kids?
Yeah.
But maybe it's my age. Maybe I look old, whatever, if I look, but I think it is coming in with confidence and coming in with a mentality that you can trust me. We'll figure this out together. This is a partnership going forward. But when I was first starting and I was second guessing myself and I was like, please don't really ask me any questions and please don't ask me if I have kids. That I think gets felt by the parents
Mhm.
at a very unconscious level for them to have to question then, are you competent here?
Mhm. Yeah. And I think of, oh, sorry, Maggie, were you going
No,
to
go
say something?
ahead.
I think even about like our littles, like, we work with kids that are 3, and like even that, to me, I'm like, man, there's so few settings where a parent sends their 3-year-old off with a
Yeah.
professional in a room with the door closed, like
Yeah.
I think about that too. And so I think parents are even trying to think through that. Like, okay, like if you're this nervous around me, like, and then I have to send you back there, and then you're not even going to tell me what's happening back there for 3 to 5 weeks. Duh, are you this nervous with my kid? So I think in that first meeting too, parents are really trying to figure out like the way that I feel with you is how my kid is going to feel with you. And I think there's a lot to be said about that too. So yeah, it's how do you make yourself feel more confident? How do you prepare enough for parent consultation so that you have so much confidence so that parents do trust you in a lot of those ways?
When I think it's like confidence and comfort too, like comfort in yourself and like comfort in helping establish the relationship with them, because I think confidence in and of itself can come off really flat. It
Yeah.
can, I've made some mistakes in the past, not through confidence, but through defiance. Um, but you have to kind of really, there's this balance of, okay, tell me what's going on. This is how I think, this is what I'm seeing, supporting them in this, asking for their perspective while also providing the information that you have. And I think having to articulate why even play therapy is helpful in addition to,
And I think that I always talk about this too. Like you're right, there's confidence and there's comfort. I love the way you said that. And I do think balancing in an intake appointment too, you're balancing the parent is the expert of the child. And I do want them to have this space to tell me everything about their kid because they need to feel heard, right? Like they are reaching out for help for the first time probably. And it is really scary. And they need to be able to tell you everything that's going on and feel comforted and supported and tell you everything ever, like download everything about their child with you. But I think the best place for play therapists to really demonstrate a lot of that confidence too is in their explanation of play therapy. And I say this to every single person I've ever talked to every time I presented. Just because a parent comes to you for play therapy does not mean they know what play therapy is. And I think if you just assume that nobody knows, then you're going to be in a great spot. And research demonstrates that adults don't know what play therapy is. There's a study that just came out about that, which I think is really interesting. And so parents will come to us from various places, like a pediatrician or a school counselor, and someone might mention play therapy, but they don't actually know what that looks like. And so I think knowing, first of all, what your theory is, and I will shout that from the rooftops, being theoretically aligned is so unbelievably important. And then knowing what your theory says about the process of play therapy, and then what that looks like for this specific parent. So if a parent is coming in because their child is aggressive, then explain play therapy and your theory of play therapy through the lens of aggression. And so you want to set that stage for them. And I think there's no better way to demonstrate your confidence than to say, here's your problem. I know what this problem looks like, and let me tell you what it's going to look like through the arc of play therapy. And to me, I think that puts so many parents at ease because I do think it answers that question of, which is a question I think we get all the time of like, do you think this will work for my kid? Or is my child too severe for this to help, right? And so, and every time, whenever you supervise, you hear various explanations of play therapy. And when play therapists say things like, and then your kid's going to play, and I'm going to watch them. I'm like, don't say that. Like, there's so much more that you are doing in the playroom. So explain that to parents. And I'm such an advocate of role playing that and talking through it and having your soundbite, because as much as you need to practice that to where it sounds confident and that you know this is my process and I know that it works, because that's what parents need to hear.
I remember I attended a session at the APT conference in California with you and Dr. Ray.
Yeah.
And one of the activities you did was line dancing of
Yeah.
yourself as play therapist. And I don't know how long we did it, but we went all the way through the line where you got to be the parent and the therapist. But there is something about practicing that over and over and over again. And I think Maggie and I have talked on one of our last podcasts. Also, sometimes we're doing this over the phone, right? We don't even get to be in front of the parent. And so making sure you put yourself in a position where I always say, do those in front of a mirror, do those someplace where you can see yourself, because if you're distracted, if you're doing a million other things, it comes across inadvertently in your communication to the parent. So be at a place where you can really focus and talk, make sure you have a smile on your face, all those little things, because they're just small, subtle, nonverbal cues. Even though they can't see you, they can hear it in the tone of your voice, in the fluidity of how you're speaking, where you're getting hiccuped. All of those things really convey different messages to parents. But yeah, I think the first speech or the speech about what you do and why you do what you do is so important. And that you kind of have a plan. Like you can see the arc of this and how that's going to support the family and support this child.
Yeah. And I think when you're talking about knowing your theory, Chrissy and I, it's really important to know your theory. And I think that's unique sometimes. I don't think a lot of people do that. But where I find it really beneficial is a lot of times, especially like where I am now, they're like, my pediatrician told me I needed CBT. And I'm like, okay, great. Right. And so I need to know what CBT is and what that looks like and how what I do is different and how they both are beneficial. So it's like, I don't ever want to disparage another person's theoretical orientation, because that's just, it's not mine. That doesn't mean that it doesn't work for other people. But I also need to know how my theory works and what do I do with it and how that aligns with what they're looking for and what's going on with their own kids. You really have to be able to knowledgeably say those things. And I think it's really easy to become distracted when parents, if you're not as grounded in this, like when parents are like, well, I need you to be more directive. And that's usually when I see my supervisees be like, oh, shoot, like I need to come do this instead. And we're like, hold on, what's going on? Where is this coming from? And a lot of times it's that insecurity because they're like, well, I don't know. And so then you're letting someone who's really scared and isn't the expert in this space drive what we're doing, as opposed to being grounded and trusting that process.
Yeah. Yeah. I'm so glad you said that too. Cause I think about, I'm in private practice right now. And I think I say this often too, like we are not salespeople. Like I know that's like, I say that in like a, tongue in cheek kind of way, but we aren't salespeople. And it isn't my job to tell every parent that the type of play therapy I do is best for everyone. And again, I think that's where the intake and even like that first phone call is so important, because I want to be aligned with the parents that I'm working with. And if I'm not aligned with them on the front end, like guess what? The wheels are going to fall off by session 4. And so I had a parent call and she was talking to me about needing services. And as she was talking, she's like, and I think he just needs some coping skills and maybe you can teach him some ways for self-regulation. And she was saying a lot of the like phrasing like this. And I'm very child-centered. And so even in that first phone call, I said, I hear you're saying the word coping skills and I hear you're saying teach. And so I want to be really clear about the type of play therapy that I provide. And so even in that little short phone call, I talked to her about, this is my belief about children. This is how I operate. This is what it's going to look like in the playroom. I'm not going to be teaching your child coping skills. And then I said, is that still what you're looking for? Because if you are wanting someone to teach them coping skills, there are some magnificent counselors. I'm really happy to give you their names. So again, I'm not a salesperson. I'm not trying to tell her, no, like this is this is not what you need. You need me, because I don't want to force her into something she doesn't want either. And so it's interesting. The doctor told me coping skills. And so, I that's what I thought. And I said, okay, great. And of course, more at the intake. And I want her to feel really comfortable with the process. But if she had said like, no, I really want someone to teach him coping skills, well, great, let me find you someone who will, and I think there's a lot of integrity as a play therapist that I think a lot of us need to have too, especially when it comes to working with parents, because you don't want to say, yeah, sure, I'll do that. And then by session 4, that's not what you're doing. And then you're going to feel that misalignment in your theory. You're going to feel that pressure to perform for the parents, and so I think it's a lot about setting those expectations too on the front end.
Yeah, I think that's one of my favorite things to talk about with parents too at the end, or like, and I tell students too, is at the end of my intake, even I'll say like, listen, like you've heard a lot, we've had a really big discussion. I'm going to go ahead and set this time aside for you. And if this isn't a fit and if it doesn't feel right, that's okay. I will not charge a late fee if you tell me, you can email me, you don't have to make this decision now. And I think as a person, it just feels good to know that like someone's addressing that. It gives you permission, whether you take it or not. It just feels, I think.
I think it helps the relationship because you create more of an equal power structure. It's not you have to do what I say or trust me blindly or do these things. It's I want you to make an informed decision here about if it feels like a right fit to you, because my belief is that if the parent doesn't feel comfortable with me, the child is definitely not going to feel comfortable. So I'm not a salesman in any way, but it is kind of my job in that first phone call or in that intake to start to build a relationship with the parent so that they can make the decision if this feels like a right fit for their child and that we're going to have a good working relationship.
Yeah. Well, I think it goes back to like what you were talking about, Ahu, about the cardiologist, right? Having someone be empathic and caring and be like, hey, this is what we're going to lay out. I don't know. That feels a lot different in it than if you don't do this, then it feels like less threatening, I guess.
But I also think in crisis, oftentimes parents can't, it's harder to make those decisions in those moments. You're just blindly trusting what the person is saying. I also sometimes don't think they hear us past a certain point. So they're really getting a feel, which is why they have all the questions in the intake or in the next parent consultation that they're asking stuff we've already covered. Or sessions later, they're like, tell me again, I thought you were going to be teaching coping skills.
Yeah.
Thought we discussed that. And then you can like kind of bring it back up. But in time of crisis, sometimes our ability to intake information is more critical based information than nuanced detail information. Or I work a lot with families who have gone through a trauma. So I see everyone at a heightened state. And so that's been my experience that I'll talk about the play process, or if they ask about, will you teach coping strategies? I will say, I won't formally teach like the way his teacher will teach. But within our relationship and with his time or her time in the playroom, they will learn techniques to help them figure out what is going to soothe and regulate them. Right. So I take a different approach. But even in saying that, my cadence, how I'm saying it is conveying, oh, okay, so this is moving towards calm over being frantic or rushing through it or going authoritative. I can never know which one is which, but like just demanding or giving instruction. I don't know. Yeah, it's hard to trust and build relationship off of that.
Yeah, and I think that's why it's so important too. Like in all the subsequent parent consultations, I know we've talked about the intake a lot, but exactly like what you said, Christy, that parents are, in that first intake, they're so nervous and there's so much information and they're just trying to like download everything they know to you. And there's a lot of worry, right? Of like, you're talking about this like fantasy land where my kid gets better soon, but I don't know if that's actually going to happen. And that's why I think it's so important that at every parent consultation, you continue to discuss the progress and the process of play therapy, again, in your theoretical orientation, because at that point, you also have a little bit more proof, right? So you can say, it's session 4. Let me tell you what I'm seeing, right? This is what the progress looks like. Let me tell you what our next 4 sessions are going to look like, because I'm going to talk to you again in 4 sessions, but let me tell you what to expect over this next month. And here's what I kind of anticipate might happen. Because again, what you're doing is you're building that trust. Like it's not just like I'm telling you the process of play therapy one time and expecting you to remember, because like that would be impossible, right? It would be hard for me for someone to tell me the process of like something I know nothing about, like, and then expect me to remember that 4 weeks later. And so I think it's so helpful because by that point too, you have actual details about the child, you have what their play looks like, you have themes that are emerging. And so to me, I even think that that first parent consultation after the intake is so important, again, to bring up process of play therapy and how it's working. Because I do think, right around that 4 to 5 week mark, parents will start to say like, okay, well, I'm not seeing anything different. It's hard for them to see progress. You see a lot of attrition at that point. And so for you to know like, okay, here is progress, even if it's small, right? Even if at this point the child just has a relationship with me, which is kind of like what we're expecting, like, let me tell the parents that this is what we're expecting at this point. And then what it should look like over the next 4 weeks. Because again, I think that just builds trust too, of this person is showing me a map and they're telling me where we are on that map and they know where we're going. And I think that just makes parents feel so much more comforted too.
Do you cover that a little bit in your initial meeting with parents too, about kind of what to expect when we meet next? Like, this is what I'm hoping over the next 4 weeks with your child.
Yeah. Yeah.
Like,
And I set those expectations pretty firmly too, because I do know, I mean, kids are going to open up so differently. And I don't want them to come to me in 4 weeks and be like, nothing's happened. And I'm like, no, we have a relationship. It was so hard to build, right? Or your kid wouldn't even leave the lobby to come into the playroom, but now they're coming and that's so exciting. And so I do share that. I do say, what I expect. And I go through and I say things like, in sessions 1 through 3, this is usually what happens. And I do talk about kind of like what that process of child-centered play therapy looks like, just so that they know, because I even say to them like, hey, we're going to set up a parent consultation at around the 4 to 5 week mark. I don't really have a ton to share with you until then, because, and I always go back to comparing it to grown-up counseling. And so I say, if you are going to go to a therapist, it's going to take you a few weeks to decide if you like that person, if you trust that person, if you want to open up to them. And if we allow adults that, then we should allow that same privilege to children, right? And so it's going to take them a little while to figure me out. And I always talk to parents too in the intake about how the play therapy room is so different than most rooms kids are in, because, I used to be a teacher. And I've worked with kids in so many different settings. And so I say things like, in the play therapy room, I'm not expecting anything out of them. There's no like exit slip that they have to do or accomplish. And so even if they just sit in the room for 45 minutes, then like it's working, right? And so it takes kids a minute to understand like, why is this room different than other settings? And so even that like permissive environment that we're creating through child-centered play therapy, it takes kids a different amount of time to really trust it, And so I share that with parents too, to tell them like, hey, by the 4 to 5 week mark, I'm going to share a lot of like insight about your child. There's going to be a lot of things that I've probably gleaned about the way they view the world and maybe some of their play themes, but I'm not going to have, you may not expect a ton of progress between sessions 1 through 4. Because I really, again, it's expensive. Play therapy is expensive. There's a lot of time involved. And so I want parents to know what they're getting into. Again, I think it's part of that like informed consent process too.
I also always love to warn them that sometimes kids' behaviors will escalate before they.
Yes.
And I remind them in that first parent consultation, I was like, okay, so how are behaviors at home? Did we escalate, or are they kind of stable, or do they seem a little bit better? And they're like, oh, they've escalated. I was like, okay, that's
Great.
a good sign.
Well, thank you for coming on. This was really great.
Thanks so much for having me, you guys. This was really fun.
It's just fun to talk about.
But come back.
Okay. I will.
Yeah.
I will.
Thanks.
Well, thank you guys.